Break a bone, you head to the emergency room. And when something breaks in the mind, believe it or not, many people are also headed to the ER as well. According to a recent CDC report from 2018 to 2020, Black adults visited the ER for mental health related concerns at a rate nearly double the national average. They had higher rates of emergency department visits compared to Hispanic and white adults across all categories of mental health disorders. Now, I've done numerous stories and podcasts on mental health issues in the Black community. This headline really intrigued me. So I talked to a therapist about why this is happening and also a mother who shared her struggles as well as her son's.
My mental health journey started as an adolescent, living in an environment or a community that also had mental health issues, and being a biracial child in a predominantly Black community. People discussing, the texture of my hair or how I looked. At some point, I was like, I was blaming my dad for, not being Black.
Tatiana Thompson is a single mother of 2 boys who is honest about her mental health struggles. She battles depression and uses counseling as a tool to help her cope.
When you were growing up, what was the attitude around mental health in your home?
The attitude around mental health was Jesus is the only way. You had to go to God, or everyone didn't believe that they needed counseling except for me.
Go to God or go to the emergency room. A new CDC study reveals Black adults are more likely to visit the ER for mental health issues than any other race. I asked licensed therapist Robin Hill why.
They're feeling distress and not knowing what the distress is, and so they go to the emergency room. A lot of times people are having very severe symptomology, and then they can't get an appointment for like a few weeks or a month out. We have children who are having very unstable moods and very disruptive behaviors, and parents are getting frustrated or even overwhelmed with how to handle these behaviors, and then not knowing what to do to manage them. And so they're going to emergency room for help, but that's not necessarily the best place for them.
Tatiana's son had an ER mental health experience.
He was suicidal. He had a moment where I was fussing and yelling about something that he didn't do, a task that he didn't complete. He was really upset, and he went upstairs in his room and he called 911.
Her son was taken to the emergency room and received the treatment and counseling that was needed. But why not before?
It's a trust thing. A lot of the counseling providers do not look like us.
What can we do, Robin, to break down this stigma around mental health and seeking the help? Because there seems to be a block there.
Being afraid to go see someone comes from being mistreated. You have to be open to hearing what they have to say, allowing your patients to teach you about themselves and not coming in there thinking you have all the answers. Mm-hmm. And that is going to help bridge that gap and reduce that stigma for that community.
It's clear more work needs to be done, and it starts in the home.
You and I have had these discussions before. We still aren't where we need to be when it comes to mental health, so that it doesn't get to an emergency room situation.
Exactly.
Yeah, here's the problem. In the Black community, and I've done a bazillion interviews on this, there is a stigma, one, that counseling is a negative thing. Mm-hmm. Number 2, you just go to Jesus, as Tatiana said, and you just pray it away. Yeah. But it has to stop, because it's a 911 emergency in the country, but more in the Black community because of the conditioning, and we don't trust the medical community, but that has to stop. And I think it really starts in the home with parents making counseling normal, in your home with your children.
And the representation is a huge part of it.
It is.
You got to go to someone that looks like you, that you can relate to, that's walked in your shoes.